My background is very much pharmacology. Trying to figure out how to get these novel targeted therapies to our patients is such an important aspect of what we do here. I'm Romina Sosa. I am a classical hematologist, and I am the chief of the section of hematology here at Fox Chase. Hematology is a group of blood disorders. Specifically within hematology, I treat bleeding disorders, the clotting disorders, the bone marrow failures, but I also treat a few aspects of what's considered cancer. So those would be myeloproliferative disorders and some myelodysplasia. We are very privileged in the sense that not only do we have excellent clinicians here, but in addition to that, we have a very talented group of basic science researchers. And we often collaborate together because it's so important for us to be able to put not only our scientific brains, but our clinical brains together to come up with treatments, options, trials, things that are going to improve patient outcomes and quality of life. When patients have a diagnosis of a myeloproliferative disorder, part of my job is to help them manage the patient's symptoms, as well as to decrease the risk of them advancing to more malignant disease like leukemia, and making sure that we decrease their risk factors and improve their quality of life. For patients that have myelofibrosis, the only curative option is stem cell transplant. And for those patients that are not eligible for transplant, the beauty is that we now have new agents like JAK inhibitors. In addition to that, we also have different targeted therapies that we actually use in combination with JAK inhibition, and that has dramatically improved our outcomes as well in terms of not only improved symptoms for those patients, but improving overall survival as well. We're partners in this process, the patient and I. My job is making sure that we can deliver the best care and to make sure that the patient's educated about what their disease is and what their treatment options are. What I find most rewarding is getting the patient through that first hurdle of that anxiety, trying to figure out what are their goals and making sure that we come with a successful plan to get them to that point. And I think that the most rewarding thing is usually just seeing how we can deliver that to the patient.